Thank you for joining us. We're gathered on the territory of the signatories of Treaty 6, and I acknowledge the Métis people who share a deep connection to this land. I'm Lori Sigurdson, the Alberta NDP Critic for Seniors Issues, Continuing Care, and Home Care. I'm joined today by our leader, Rachel Notley. Albertans were outraged when they learned that motel medicine was actually happening in Edmonton. But we should not have been shocked to learn through the media that 27 patients, including a 62-year-old man paralyzed on the left side after a stroke, was discharged from hospital to a travel lodge in Leduc. We know Daniel Smith mused that motel medicine was the answer. Well, it's not. When a patient leaves hospital, some go to continuing care or supportive living facilities with every expectation that their care needs will be met and they will live in an accessible, safe, clean, odor-free environment. Unfortunately, as motel medicine proved, that is not always the case. The UCP government track record for seniors care is undeniably abysmal. And the UCP's new Continuing Care Act that just came into effect illustrates how little this government values the lives of our grandparents, parents, extended family, and friends who live in continuing care or supportive living. Until April 1st, Albertans were assured their loved one would get a minimum standard of care. It was in the law. Now, there's no guarantee. The new Continuing Care Act regulations have eliminated required hours of nursing care. Although woefully inadequate, the previous legislation had a minimum of hours of care. Now, the government has completely eliminated that. Why? Well, Health Minister Adriana LaGrange argues that eliminating minimum standards of care will somehow improve services for Albertans. She said she engaged the operators and heard, and I quote, that they wanted flexibility and ability to manage their staffing levels, and so this is an answer to that flexibility, end of quote. Flexibility? What does that mean? Does it mean the government's new policy will allow some operators to be exempted from following the rules instead of ensuring the rules are obeyed? I believe all Albertans should be concerned about where this is leading. I'd now like to turn the mic over to Rachel.
Well, thank you so much, Lori. Now, before we go through the information that we found and will share with you today, I just want everyone to understand that we are talking today about homes where some of Alberta's most vulnerable citizens reside. We're talking about seniors who need various levels of care, as well as younger people who, for a variety of reasons, cannot live independently. In many of those cases, they're just not able to advocate for themselves. So, care. Now, even before these so-called flexible regulations came into force, what the data shows is just how inept the UCP is at ensuring our loved ones are getting the high-quality care they deserve. These care standards are the legislated minimum requirements that operators must comply with to keep care home residents well-fed and staff appropriately trained. However, this uncovered data shows that compliance with these standards is falling under the UCP significantly. Inspectors are increasingly finding problems that operators must follow up on in a timely manner. In 2023, for instance, there were nearly 2,000 more issues flagged as non-compliant than there were in 2018. Or, put another way, the number of non-compliant issues have nearly doubled since 2018. Some of these issues in our continuing care facilities include 59 inspections that resulted in non-compliance for hygiene issues. Of these, 32 inspections found that policies and procedures weren't properly in place to ensure that seniors were given a minimum of 2 baths a week. We're talking about very basic care you would expect that your loved one receives, and that they are therefore clean and comfortable. There are 138 inspections resulting in non-compliance on infection prevention and control. 45 inspections resulted in non-compliance findings related to nutrition and hydration. Do I have to say it out loud that our loved ones deserve basic food and water? Additional inspections on a different government website, performed by public health inspectors, found some of the kitchens in these very same facilities were also failing to meet important cleanliness and hygiene standards. For instance, we saw examples of rodent droppings in one of these kitchens. Unbelievably, another facility had 12 non-compliant inspections about odor control. The original inspection and call for compliance around that was on May 19th, 2023. Further inspections on May 24th, June 2nd, June 9th, June 14th, June 19th, June 30th, July 31st, August 30th, September 26th, November 29th, and December 15th all showed that the facility remained non-compliant. And it was finally fixed just weeks ago. How does one facility get 12 non-compliant inspections for the same issue and no immediate implementation or enforcement consequence in relation to the failed solution? It boggles the mind that the government refused to take timely action to hold that particular operator accountable. So why is this important? Well, Albertans should expect and demand that their loved one's quality of life is a priority of their government, especially when that loved one is in a place, living in a place, over which they have limited control. And they are, in many cases, as I've said, unable to advocate for themselves. And these kinds of expectations should not be flexible. All of this is important because it demonstrates that neither these providers nor the government have earned the right to be flexible. If anything, this shows greater need for standards and more resources for inspection and more resources for enforcement and the political will to follow through on both. We should never be reading news stories like the one in January about an Alberta senior with dementia who was admitted to a hospital with multiple serious infections because her children discovered that she had suffered medical neglect at her nursing home. And what we're talking about today is important because less than a year ago, one of the largest E. coli outbreaks in Canadian history actually happened as a result of a kitchen facility that served daycares in the Calgary area. And just like in the cases we're describing here, there were months and months and months of repeated violations before the outbreak that ultimately led to the hundreds and hundreds of E. coli cases. That outbreak impacted 11 sites, putting 38 children and 1 adult in hospital, 23 of them who were hospitalized and required dialysis. Now, what we're talking about today also matters because in February, a CBC story revealed that the Alberta office that investigates abuse in care stopped publishing outcomes and reports, and the cases that are not being published are piling up. Fact is, the government used to publish those reports on an annual basis, and they would publish reports and summaries of what inspectors for the Protection for Persons in Care had found, but nothing's been posted online for at least a couple of years. And while this accountability has fallen off, what do we know? Is that there are over, for instance, last year, 100 founded reports of abuse and neglect. But regular families should not have to wade through FOIP applications and documents in order to determine where instances of neglect and abuse against seniors are occurring across the province. So, we need accountability, we need transparency. Today, we come on the basis of this information and we have 4 asks. First, there must be a 4-hour minimum care standard, just like they have in Ontario. It should be legislated. It should not be in the regulations, and it certainly, to goodness, should not be flexible. We know that staff in continuing care and supportive living facilities are overworked and underpaid. Chronic underfunding and understaffing have spelled disaster for the system. We also need better enforcement of all standards, including minimum care per resident, along with the other care standards we're talking about today. It's clear the UCP doesn't empower inspectors to get things solved in a timely manner. So we need tougher rules for those who are frequently inspected and found to be dropping the ball, not more lax so-called flexibility. Our third ask is that all of this information should be transparent and easily sourced in one place. As I said, residents and their families and their advocates, their loved ones, shouldn't have to check multiple places to see if there have been health code violations or abuse instances in the kitchens and the hallways of long-term care facilities. This information should all be in one place, and it should be regularly reported on transparently to Albertans. And our fourth ask, which is critical to stopping these things from happening, is that the UCP must restore and expand both the independence and the scope of the seniors and disabilities advocates in this province. It is tragically clear that the UCP is failing seniors and other vulnerable adults. And in light of the horror of motel medicine, Albertans need these advocates to fight for them. All of this is important because the data we are talking about today clearly shows that the incidence of substandard care and maintenance have doubled since 2018. It shows that these incidents happen over and over and over again, and enforcement is stretched and ineffective. There is a dangerous lack of transparency and accountability that is growing under this UCP government. And so we all need to be deeply concerned by their use and pursuit of more flexibility. Thank you, and we're happy to take your questions.
All right, thank you, Rachel. We'll now go to questions. Just a reminder for those joining us on the phones to use *9, and for those joining us on Zoom to use the raise hand function to get into the question queue. Our first question comes from Michelle Belafonte at CBC. Go ahead, Michelle. Your line should be open.
I was just wondering about the data. And I've had a chance to look at the site a little bit, but there's a lot there, as you know.
Yeah.
Is the non-compliance, is it both in homes that are for-profit and non-profit, or is it predominantly for-profit? Like, what did your researchers find?
So first of all, there's more than one site. There's multiple sites. So that's the first thing to know, is that it involves, I think, navigating through at least 3 different sites. But there doesn't seem, from what we were able to pull up at this point, there doesn't seem to be a clear pattern. It does involve both public, not-for-profit, and for-profit sites in all cases. I think it's fair to say that we're experiencing significant care challenges across the board right now.
Do you have a follow-up, Michelle?
Yeah, and you probably can't answer this, but I'm just curious. I mean, was there anything that they found why the inspections went up so much last year?
Well, it wasn't I will say it wasn't just last year. It was just that, we picked 2018 to look at sort of the trend. So there wasn't certainly anything in there that suggested the rationale, and there wasn't, because the reports are not detailed enough to give that kind of information. So that's a good question for the minister. Why did they double?
Okay.
Anything further, Michelle?
Yeah, just one last question. I mean, so this is really broad, but how do we solve this problem? Because yes, I mean, it's probably staffing, but as we all know, I mean, there's staffing issues across the country in this sector. So how do we solve this problem?
Well, that's a really good question. So we did outline a few proposals, but to talk about the staffing, one of the things that you need to do is, obviously, you will get more staffing if you pay people fairly. You're not going to compel operators to pay people fairly if you don't demand that they adhere to a certain level of care. You will not get that level of professionalism and the obligation to adhere to that level of care if you inject flexibility into an increasingly for-profit system. So the path that the UCP is on right now is going to take that problem and make it worse. What you need to do is you need more independence and you need more transparency and accountability, which we call for. Then you need an independent form of oversight, which we're talking about through the Seniors Advocate and the Disabilities Advocate. Then you need proper, strong rules and laws that have consequences attached to them if you don't follow through with them. And ultimately, that may need more money. But quite honestly, we are talking about basic standards of care for Albertans most vulnerable and people we love who we want to ensure are safe. And so, sometimes that involves professionalism and accountability and, more resources.
And our next question goes to Catherine Krakowski from Alberta Today. Go ahead, Catherine, your line should be open.
Oh, sorry, I thought I lowered my hand. But I'm wondering, so is this a matter of increasing the number of follow-up inspections? Do we need to increase staffing levels? I know you outlined those 4 suggestions, but what were some of what else needs to be done, I guess?
Well, I mean, I think obviously what we are seeing here, what these inspections, which, a lot of us had to spend a lot of time finding, show is that the system as a whole is under stress. And the way you start to fix that is you set a standard, you make it inflexible, you hold yourself to account for it, you set up consequences if you don't meet it, and then you resource appropriately to ensure that you meet it. So this is not actually rocket science. It only becomes complicated if you're trying to invite people in to make money while doing it and to slide the standards down. And so if instead you adopt as a matter of humanity and as a matter of being caring for your neighbors and your community and the people around you, higher standards than the practice to get there is pretty clear.
Anything further, Catherine?
Yeah, and you had mentioned that February story about the protection for persons in care reports. It used to be published annually. Was there a legislative requirement to publish it? I'm just wondering, do you have any insight into how that reporting fell off?
I don't have much more insight than what the government claimed at the time, which was, sheesh, it got away from us. It does need to be reported. I'm pretty sure there's a legislative requirement under the Protection of Persons in Care Act that it be reported. If not legislative, then regulatory. But they're simply not doing it. That's a problem, because what we know from what was discovered through the FOIPs, and thank you to people who took the time to go through those FOIPs, is that just slightly over 1/3 of the abuse allegations were found to have occurred. So if you're having, and that's just in reaction to complaint, and so understand that's not an oversight of all the abuse. It's just the ones where complaints were filed for protections of person in care. I think it's fair to say many people don't even know that they exist. So there could easily be many other instances out there. So it's not acceptable that the government said, oh, gee, we're behind, and then washed their hands of it and carried on. This is very, very important information. And the fact that they are not meeting the standard of reporting at the same time that they are changing their legislation in order to increase more flexibility and to reduce the standards is deeply and should be deeply concerning to anybody who thinks that at some point they or their loved ones will require the support that people seek out in these settings.
We'll go back to Michelle Bellefontaine from the CBC. Your line is open. You muted yourself, Michelle.
There we go. Okay. Yeah, so I was wondering about just in terms of, like, in the early days of the pandemic, a really big issue was that how staffing, like people were staffed at different sites, like someone was part-time somewhere, would work at, and so that seemed to have been a little bit resolved, but it seems like maybe they've gone back to it. I mean, I'm wondering if you or Lori has heard any, kind of stories about that how people are kind of back to working that way, or if maybe the operators have learned their lessons and maybe that they're keeping people full-time at the same sites. that was a really poorly phrased question. I'm sorry, but
Well, let me start, and then Lori can jump in, because I know she's been advocating for this a lot. But let me just say at the outset is that I don't know that it actually was resolved here in Alberta. We have very fragmented care systems in Alberta. We don't have, it's a high percentage of private care, and we don't have an employment regime that would allow workers to have a permanent position in one spot. So for instance, in BC, because they have a much higher rate of unionization, and they have an overall organization that manages continuing care, they were much more able to ensure that folks were not moving from place to place and could in fact still make a living. In Alberta, because we're so much more privatized, and because people who work in that sector in this province get paid so much less, it's much, much harder to achieve. And so I don't believe that we ever actually did fix the problem. And I think, as with all things in healthcare, the shortage of healthcare workers is showing up in this sector in a way that it's getting worse. But let me just pass over to Lori, because I suspect she even knows more than me, probably, usually does.
Well, I certainly agree with everything that you've said. I just want to also add that even during the pandemic, when they said a single site only for workers, they also said there was all sorts of exemptions to that. So people really weren't working only at one site, because they sort of gave them a free pass, the UCP did. And absolutely, I hear stories all the time about chronic understaffing, they're not being supported. And of course, with this new Continuing Care Act regulations indicating that there's no minimum standard of hours because of flexibility that the minister says the operators need, that just gives them an opportunity to have, to keep it going this way, to not be responsible and accountable. And what about the vulnerable people who live in these facilities? So the issue was never fixed, and it's chronic, and it's very disturbing that so many operators are not, really doing what's seen as the minimum care standard of 4 hours, and our government is saying to them, I want you to have flexibility. But we're, of course, neglecting seniors in these facilities because of that.
Anything further, Michelle?
Yeah, just one more question for Lori. I mean, ever since this came out about these, the changes to the regulations, have you heard from families concerned about the change, that there's no minimum standard of hours, care hours for their loved ones?
Yes, I have, and certainly, I'd heard before, but obviously it was 1.9 was one in the regulations, so we all know that was abysmally low, that was not enough, and 4 is seen as the standard that's minimum that should be implemented, and as Rachel said earlier, Ontario has that legislated. So people are, it gives them no recourse, to challenge facilities about them ensuring that their loved ones have this minimum standard of care. So it's going from bad to worse.
All right, with no further questions, we'll wrap today. Thanks, folks.
Thank you. Thank you.
All right.